The ongoing COVID-19 crisis had a severe impact on all aspects of development and development worldwide. Huge spending has declined, travel and tourism has been affected, and industry has slowed down due to the movement restrictions. Economic activities and services such as transportation and shopping were also affected, which has raised a lot of questions, which of course led to primary focus, which is research. Launched in March last year, the Oman COVID-19 Research Steering Committee made up of experts from several research institutes in the country. To talk about this incredible program, it's an honor and privilege to have with us the Director of COVID-19 Research Program at the Research and Innovation Sector, the Ministry of Higher Education, Research and Innovation, Dr. Salah Zadjali. Doc, welcome to the program.
Hi, Frank. Thank you for the invitation.
Talk to us a little bit about your research thing and how relevant is the COVID-19 research program initiated by the Moheri in March of 2020. That was last year.
Yes, as you mentioned correctly, the program was launched last March, and it was headed by us, by the Research and Innovation Sector, together with having a number of committee members from various research institutes in the country, whether it be from the Ministry of Health or other governmental and private colleges and universities. Here in this program, we had several objectives. The main one was to find evidence-based solutions, advice, which can later be translated into policies and regulations to control this pandemic. We also wanted to upgrade the level of clinical research in the country. Besides that, we wanted to have a more resilient emergency and disaster management system that can help us during this pandemic. And we also wanted to foster multi-sectoral collaboration between the government, academia, as well as the private sector. For this program, we had two main domains for research. The first domain focused on clinical medicine and public health aspects. And here we had a number of themes, including the diagnostics for COVID-19, how it can be treated, its therapeutics, the role of telemedicine. As you know, during the pandemic, a lot of people suffered from panic attacks. They were stressed out. So we wanted to also look at the psychosocial aspects of COVID-19, as well as emphasizing the importance of adopting appropriate preventive strategies. That was on one hand, in relation to the clinical scope. On the other hand, we also looked at non-clinical themes, which included mathematical modeling, simulation and predictive analysis, tracking and monitoring technologies, artificial intelligence. We also wanted to look at the impact of COVID-19 on our economy and businesses, e-learning during pandemics, as well as in relation issues in the country. So this is in brief about the program.
So how many are you in the program? How many experts are comprised with the program?
Oh, right. We had two committees. The first committee focused on clinical research, and here we had around 7 committee members from 5 institutes. On the other hand, for the non-clinical team, we had again around 6 or 7 committee members. This was for the supervising committee. In addition to that, and in relation to the research projects, that we approved a total of 27 projects.
All right.
By now, some of these projects are already completed. Around 10 projects were completed successfully and fully, and the remaining ones are still undergoing.
Can you tell us about the projects that you're having right now? They're finalizing?
Yes. I'll give you some examples of the completed projects. In one of these, they made use of drones in order to detect the temperature of people.
Okay.
And this was from a distance of 3 meters.
Wow.
So these drones were enhanced and modified. New sensors were added to them, and using artificial intelligence, they were taught how to detect the temperature, facial expressions, and to distinguish the body language of the participants, whether they are sneezing, coughing, which are some of the most important symptoms and signs for COVID-19 infections. In other projects, they wanted to predict the future based on historical data in terms of patient characteristics, the policies and the measures that were introduced in the country over the previous months. And based on these variables, they wanted to predict the trend of the pandemic in the future, whether we are going to face an increase in the number of cases, stabilization, or whether we'll be able to successfully control the pandemic. So these are two examples of the completed projects.
So where are we now in this new development so far, Doc?
Yes, we are left with some more projects to be completed over the coming few months, and the whole program was supposed to run over a total duration of 1 year, from June last year up to June this year. So we are left with few more months to go.
How about the funding?
Yes, regarding these projects that we approved for funding, the funds were transferred straight away in the beginning of the program to the research institutes.
Okay.
So that they won't face any issues with financial crisis. At the same time, we also encourage the research institute to contribute additional funds whenever needed.
Especially the private sector right now. You guys are really interested to donate your expertise, whatever it is that you have. You could contact COVID-19 research just in case if you have anything that could probably contribute to the development of this COVID-19 research. And they could contact you, Doc, right?
Very true, very true. Actually, we were preparing for a workshop where we wanted to invite all the main partners and the interested parties, including governmental organizations as well as the private sector. Why? For two main purposes. First, we want to disseminate the results and the findings of these projects to everybody, officially as well as to the general public. That is one. Second, some of these projects, as I mentioned, came up with real products, which can be transformed into commercial products. And this requires the participation of the private sector with us in order to adopt these products and to convert them into commercial products, eventually to boost the country's economy. So we are planning to conduct that workshop, but as you know, because of the recent decision from the Supreme Committee to ban any mass gatherings for the time being, so we are just waiting to see what will happen in the near future. And once we are able, once the ban is lifted, then we'll straight away arrange for this workshop.
Okay. Do you have any contacts with some pharmaceutical companies in other parts of the world that you could have some, collaboration with?
Actually, the researchers themselves established partnership with international experts from various universities or companies worldwide. So they can deal with them directly. Already established contact with the advisors and the consultants worldwide.
Can you comment on how the National Strategy for Research and Development 2040 is taking shape right now?
We already finalized the strategy itself, and during our last annual research forum, we presented the executive plan for this national strategy, and now it is underway.
Okay.
We want to disseminate the plan with all the main partners so that they start working on it practically.
So where do all these research and development programs lead to right now?
From these research projects, we expect three main things. First, to come up with practical, applied solutions to help us to control the pandemic. Not only that, but these solutions should also be useful in the future for other similar disasters. That is one thing. Second, we hope that the main partners, particularly the governmental partners, will adopt these findings and translate them into policies and regulations. Third, we always hope that the research project will result in real products that can be converted into commercial products to boost the country's economy. So this is what we are working on.
With the COVID-19 pandemic, we have seen rumors and fake news circulating, especially on social media. How can communications be improved to stem the spread of this misinformation and improve public understanding, Doc?
This is one of the reasons why we are conducting this research project, because we want evidence-based data, accurate and correct data.
The pandemic has changed our daily habits, but also our professional objectives. Are there any research priorities emerging in the future in your case?
Yes, definitely. In the past, we thought that we are over infectious diseases. This is not only in Oman, but worldwide. But because of this ongoing pandemic, it became very obvious that there is still a high risk for infectious diseases at any time, no matter how good clinical medicine is at present.
Precisely.
So because of that, now we are emphasizing the importance of improving and solidifying the infrastructure for clinical and medical research in the country.
Initiated in March 2020 by the Ministry of Higher Education, Research and Innovation, or MOHERI, has been progressing successfully. Some projects are complete, while others are underway to make recommendations that may support future policies. This pandemic situation will impact all levels of the government, planning for emergencies, risk assessment, and include pandemic effects. Everybody is gaining experience here before learning to act or what to do. Researchers look for efficient solution here. COVID-19 is new to everybody. Every country have their own strategies on reported cases, especially here in Oman. Thank you very much, Doc, for your time here. It's a huge honor to have you in our program. Talk about this new development right here, the COVID-19 Research Council.
Welcome, Frank, and thanks to you.
Okay, so all the best and more success on your upcoming research project and plans for the future.
Inshallah. Thank you so much.
Okay. That's Director of the COVID-19 Research Program of the Research and Innovation Sector of the Ministry of Higher Education, Research and Innovation, Dr. Salah Al-Zadjali. For Inside Oman, my name is Frank. Thanks for listening.